Good evening and thank you for keeping it TV47. You are just in time for Body Garage with I, Sheila Chelangat. And of course, you know here is where your health matters. And in line with this year's World Glaucoma Week, this episode we are focusing on glaucoma, and taking us through it is Dr. George Ohito. How are you, Daktari?
I'm good. How are you?
I'm good. Could you introduce yourself to us?
Yes, as you've said, I'm George Ohito. I'm a senior ophthalmic clinical officer and a cataract surgeon at City Eye Hospital here in Nairobi. Yes.
We are talking about the world awareness for glaucoma. First, why is it important to raise awareness for this particular eye condition before even we get to what it is?
Let's consider the magnitude of blindness worldwide. Glaucoma is one of the major causes of blindness. It's estimated by the WHO that 76 million are blind because of glaucoma. And when we talk of 76 million, it's 76 million blind in both eyes. So it's huge. Secondly, glaucoma has been described as a silent thief of sight, meaning there are no symptoms. You become blind without knowing, no pain. And by the time you come to see us, significant damage has been done.
Okay. Yeah. So let's get to it. What is this eye condition called glaucoma? What causes it?
For the eye to function normally, there is some pressure within the eyeball that is within normal. When we measure, say, anything between 10 and 20 millimeters of mercury is normal. However, there are variations. When the pressure inside the eye goes too high, it damages particularly the optic nerve. That is the connection between the eye and the brain. And that damage is what we describe as glaucoma. Yes.
Okay, you're talking about the eye pressure. If you could just expound on it, what even causes it to become high? And what is the normal?
The normal is between 10 and 20 millimeters of mercury. The tissues of the eye work under certain pressure. This pressure is maintained by the production of fluid within the eye, which we call the aqueous fluid. Now, once produced, it has to be drained out of the eye. There are circumstances where the drainage channels are blocked. And when there is blockage of the drainage channels, the pressure will go high. Yes.
Okay. Now, you said that sometimes someone might not present the symptoms. So then how do I know that I could be getting glaucoma?
So we have to look at the risk factors.
Yes.
One of the main risk factors for glaucoma is age. As you grow older, the risk increases. Now, we have accepted that anybody above 40 should have their eyes checked periodically, possibly annually, because we may just as well catch glaucoma before you go blind. If you are an African, it's said that Africans, Asians, and Hispanics are more at risk of glaucoma than anybody else. If anybody in your family, a parent or a sibling, has glaucoma, you have an increased risk of developing glaucoma. If you've had injury to your eye, the risk is increased. If you have other medical conditions that are treated with steroids for long, then you are at risk of getting glaucoma. And to you, if you have a combination of all these, yes, then you need to have your eyes checked much earlier by your eye doctor or eye ophthalmic clinical officers or optometrists to rule out the possibility of you having glaucoma, because you may not know.
You've mentioned that if it is in the family, you are at risk, to mean that glaucoma is hereditary.
Most of it is hereditary. Some just occur. Yes.
Okay. And at what age does this condition begin for those who are at risk because of their age?
Let's say anybody is at risk of glaucoma. We just say there is increased risk as you grow older. Children are born with glaucoma, congenital glaucoma. Children develop glaucoma as they grow. We call them developmental causes of glaucoma, which are a variety. By the way, glaucoma is not a single disease. It's a group of diseases. But the presentation and the end game is the same. Loss of vision because of damage to the optic nerve.
So when you say you wouldn't normally present a symptom, you wouldn't know you're getting glaucoma, are there people who perhaps now, once it is at that stage that now it's glaucoma, they come in with some symptoms?
Yes. The main symptom usually is loss of peripheral vision. As I sit, I can see you and I can see the wall, quite a large area.
Yes.
Glaucoma gradually reduces your peripheral vision until you are only able to see what is in front of you, and that still gives you a normal vision, but you cannot walk past a table like this because you will not be seeing what is in the periphery. The most common glaucoma, we call it chronic open angle glaucoma. In the eye, we have the production of aqueous, which then is drained in an angle here. Yeah? And this angle, there are drainage channels. The drainage channels may be blocked, but the angle remains open. That is the commonest. We also have angle closure, where the iris flips forward and blocks the angle, and then the fluid cannot drain out of the eye. We call that closed angle glaucoma. So there are very many types and subtypes of glaucoma.
Let's get to the fluid. What is this fluid and what is its importance first in the eye?
Inside the eye, there are two bodies of fluids. In front of the lens here, we have the aqueous, which is very similar to other body fluids. But at the back, we have a large area of a gel, which you call the vitreous body. That's not very important. The aqueous fluid bathes the lens. The lens has no blood vessels, so it has no way of getting its nutrition and getting rid of the byproducts of metabolism. Likewise, the cornea in front only gets its nutrition from the aqueous. But once that nutrition is absorbed and the waste products are produced, they have to be gotten rid of through these channels as new aqueous is being formed by the ciliary body. Yes, so it's a continuous process. Yeah.
So if you clarify, this fluid is not tears.
It isn't tears. Yes.
All right.
Yeah.
You have mentioned what is the most common type of glaucoma in Kenya and cases, in terms of the cases you have seen as a doctor.
Chronic open angle glaucoma remains the most common and affects mostly people of advanced age, and for Africa, 40 years and above is advanced enough.
Now, you've said it ultimately leads to blindness. So does it mean it cannot be cured?
For patients, they want to hear the word cure.
Yes.
For glaucoma, we can only promise to delay blindness as long as possible. So if we can delay blindness for 30 years for a 50-year-old person, we will have achieved something. If we can delay it for 50 years, that would even be better. You will die seeing. The reason is once it starts, it's a progressive disease. If we catch it early, we can start you on medications. We have two end games. One is to reduce the production of aqueous so that the pressure does not rise. The other one is to encourage or improve drainage so that more of the fluid goes out. And occasionally we combine the two in severe cases. So anytime you have a disease that is not painful and you prescribe medicine, people forget to use their medicines.
Okay.
And that is the major cause of problems in glaucoma.
So every time someone has high eye pressure, it means that they're definitely a candidate of glaucoma.
Yes.
Okay.
There are variants. We may measure your pressure and find it high, but there is no damage in the eye. There are other things we will have to check. The thickness of your cornea. We have realized that if your cornea is thick, the pressure measurements may be higher, but we moderate that using some calculations to know whether you have glaucoma or not. If your cornea is very thin, the pressure may be read as low, yet you have damage. And when we do our calculations, we find you actually have glaucoma. So there are many measurements that we need to take care of.
Okay, and let's get to the congenital glaucoma for the children. For now, there is no cure as well, and will they grow up now to be blind?
You may be born with advanced glaucoma that simply there is no treatment. Now we have to deal with a child who is born and will live all their life blind. You may be born with some damage or no damage at all, but as soon as you are born, we recognize that there is danger. So what we do is try to treat medically and surgically to reduce your chances of going blind. We do succeed in quite a number of cases. Occasionally, the results are not as good because it also depends on what damage was done to the eye structures during the formation of the embryo. Sometimes the damage is that you cannot reverse.
Okay. Yeah. Before we get to how now you get to the diagnosis, I'm wondering, does it affect just one eye or is it both eyes? Can you have glaucoma in both eyes at the same time?
You would be lucky to have glaucoma in one eye, and it happens. Most of the time, glaucoma is a bilateral disease. Of course, in cases like trauma, then the risk is higher in the eye that was injured, but not the other eye. But when we talk of the general population, chronic open-angle glaucoma, congenital glaucoma, then we are talking of bilateral disease.
Bilateral. All right. Let's move to the diagnosis. What do you look at? Because you said sometimes you can even be confused for cataract. Some would be treated for cataracts instead of glaucoma. So before you make your diagnosis as a doctor, what do you look at?
Anytime a patient walks through our doors, number one in our mind is to search for signs of glaucoma. Because as I said in the beginning, it's a silent thief of sight.
Yes.
So you will not know that you have glaucoma. So even if you have come to change your glasses, we would like to peep through your eye to look at the health of the optic nerve. Because that is usually where the problem is. So we measure the pressure using our machines. Here we have what we call a slit lamp. It's just a microscope to magnify the tissues as we see them. But on the side here, we also have something we call a tonometer. A tonometer, this one will touch your eye briefly, and we record the pressures. So we check the pressure, and we also look at the back of your eye. This system is a clear system all the way
To the back.
to the back. So we look at your nerve after having measured the pressure.
Okay, Daktari.
That will tell us the situation.
All right.
Yes.
Thank you so much for taking us through that. We are up for our first commercial break. When we will be back, we will now learn what are some of the treatment options that are available for glaucoma. Do not go too far, but first take a look at the myths and facts of the day. Glaucoma can only affect older people. Glaucoma can affect people of all ages, although the risk increases with age. Glaucoma can be cured. There is currently no cure for glaucoma, but treatments can help manage the condition and slow its progress.